Just a little fun historical fact. The name is actually, it means the smell of a horse in Sanskrit. So it refers to both the scent of the root and the belief that it imparts the strength and stamina of a horse. So, with all of that being said, let's take a look at a picture from the Journal of Herbal Medicine published this year on how ashwagandha helps to reduce stress. As you can see, there are multiple points of data on how ashwagandha works. But if we want to just understand the core pharmacodynamics, let's just focus on two major pathways, the GABA system and the HPA, hypothalamic pituitary adrenal axis. And so ashwagandha helps regulate the HPA axis, which is your body's central stress response system, right? So when somebody comes into the office and they have chronic stress, chronic fatigue, we're thinking of many things. So one of the things we should also be thinking is HPA axis, like what is happening with this person's hypothalamus, pituitary, adrenal signaling system. So kind of always keep that in mind. The body's central stress response system, your HPA axis. So studies show ashwagandha can lower elevated cortisol and DHEAS, meaning the HPA isn't firing excessively for your patients. And in simple terms, it just kind of helps to reset the body's stress thermostat. So that's kind of the adaptogenic aspect. It helps your system adapt to the stress response. It also affects the GABA system. So GABA stands for gamma aminobutyric acid, which is basically like a neuroinhibitory transmitter. So it helps to calm things down. So you want to think about GABA systems for your patients who are a little too wiry, anxious, that kind of thing, overstimulated. Ashwagandha appears to enhance GABA activity and receptor function, so helping to regulate overactive neural brain circuits. They're going to drive anxiety and tension. And so by supporting both HPA axis and the GABA tone in the system, ashwagandha can also improve sleep quality, reducing sleep latency, so it's easier to fall asleep, less time falling asleep, and also enhancing deeper stages of non-REM sleep. And then obviously better sleep, you just feel better overall. And then overall, with that being said, ashwagandha acts as an adaptogen, which is kind of what I mentioned earlier, helping to reduce the sympathetic tone, so reducing that fight or flight response, right, which most of us, kind of tend to live in, reducing that sympathetic nervous system response, and then lowering the allostatic load, which basically improves the body's ability to adapt without getting overwhelmed. So ashwagandha is a really cool kind of standard stress botanical in the world of botanical medicine. And you may want to take a deeper dive. I mean, there's some really cool studies outside of just the stress picture and what ashwagandha can do in the system. So just a clinical trial to think about. In a randomized double-blind placebo-controlled study published in the Indian Journal of Psychological Medicine, this was around 2012, they evaluated the effects of ashwagandha for chronic stress. So it's a prospective, randomized, double-blind, placebo-controlled trial. 64 adults with chronic stress. They took 300 milligrams twice daily of high concentration ashwagandha extract, so a total of 600 milligrams daily, right, for 60 days. And they measured the perceived stress scale, anxiety scores, and also their serum cortisol, which is really important, a little more objective, if you will. And then in the results, what they found was there was a significant reduction in stress and anxiety scores. Cortisol decreased significantly versus placebo, and adverse effects were mild and similar to placebo. So the big takeaway there that as a clinician that I think about is that cortisol picture being decreased significantly, because how many of our patients are just on overdrive and kind of chronically stressed with life and all the things. So this is a really nice way to help support them with evidence-based botanical medicine. So in conclusion, 600 milligrams of a standard ashwagandha extract for 2 months reduced perceived stress, anxiety, and cortisol in adults with chronic stress.
And then there's another question here about patients with often experiencing panic attack and low cortisol due to chronic stress. So obviously ashwagandha, if you get the patient's labs, which is something we go deeper in the functional medicine training, you're going to be able to determine where ashwagandha is more beneficial and where it isn't. There's a way to decrease cortisol. Ashwagandha sometimes work more as a regulator of cortisol secretion. There is a way to support lower cortisol, which might be different. But if they got a panic attack and they got low cortisol, from my experience, it'll typically mean that they have some sort of there's either stage 3 or 4 of the subclinical adrenal insufficiency. Because physiologically, whenever we experience stress, someone cuts you off, you have too much stress at work, whatever it is, you're going to secrete higher amounts of cortisol. And if you don't, what typically that means is that your that system has been abused, right? That's in like layman terms. This question about pregnant women and women taking birth control with ashwagandha. Do you want to answer that?
Yeah, I mean, there's not any like studies around ashwagandha in pregnancy. I know like in Ayurvedic medicine and some pregnancy formulations, they do use it, but I don't necessarily know if it's been clinically, I know it's not been clinically studied in pregnant women, or we don't have sufficient data to say if it's safe or not. So I probably would just generally avoid that for the sake of the fetus and just not knowing what the impact could be.
Absolutely. And so when it comes to birth control, it's less of a concern. But if they're pregnant or breastfeeding, those herbal compounds could go into the fetus or the baby. They can impact, have some impact. So we typically tend to avoid. But that's why in our programs we also teach you nutritional compounds and dietary and lifestyle strategies. Then if the patient, you can't use herbs, right, for whatever reason, then you got option B, option C, right? You got other options that you can go into.